So how do we investigate? You need to do your diagnostic investigation like a posterior anterior chest X-ray. So if it's a lobar pneumonia, remember that it's just one lobe segment that will be um, how will have the pneumonia. Okay, so when you see just a lobe segment, then you know that oh, you're dealing with a lobar pneumonia. If it's patchy, when you look at the X-ray, it's just patchy all over the place in both lobes, then you know that oh, this is a broncho pneumonia. All right. Complications, you may also pick up complications on the X-ray like pleural effusion and lung abscesses or pneumothorax, etc. All right. After doing your X-ray, you want to take a sputum sample. You look at the sputum. Okay. If it's yellow, green, greenish, or blood stain, it can point to a pneumonia. All right. Then you take it to the lab for microscopy. They can do a gram stain to find out what bacteria is causing, whether gram positive, gram negative, a zoonosis stain for TB or gene expert. Okay. You can also do a culture and sensitivity, but this will come after some days. All right. Then you can also do a nasopharyngeal or oropharyngeal swab. You can do a PCR on that for COVID. Okay. So supportive investigation, this won't diagnose, but they'll tell you that oh, there's an infection going on. That's why it's called supportive. So you do a full blood count, you'll see leukocytosis with differential neutrophilia if it's bacterial. If it's viral or TB, you'll see lymphocytosis. All right. For BUE, it's also a supportive. You'll be wondering, why should I do a BUE in somebody with pneumonia? Because remember that the complications of pneumonia, when we spoke about it, we said there were local and then there were systemic. And the systemic ones are usually as a result of sepsis when the bacteria has spread. And you can even have an AKI. Okay, so when if their urea is more than 7 millimoles per liter, it's a sign of septicemia in which the kidneys have been affected. And they can also have hyponatremia. The explanation, they said, is poorly understood. Okay, but if there is hyponatremia in the context of pneumonia, it's a marker of severity. All right.